Is it normal to have a negative pregnancy test at 5 weeks pregnant?
Hey there! Welcome to today's video where we'll be discussing an important question many expectant mothers have. Is it normal to have a negative pregnancy test at 5 weeks pregnant? Let's dive right in and explore this topic further.
Understanding pregnancy tests.
To better understand the situation, let's first discuss how pregnancy tests work. Most at-home pregnancy tests detect the presence of a hormone called human chorionic gonadotropin, HCG, in a woman's urine. HCG is produced by the placenta after a fertilized egg attaches itself to the uterine lining. The levels of HCG increase rapidly in the early weeks of pregnancy.
Timing and sensitivity of pregnancy tests.
One crucial factor to consider is the timing of the pregnancy test. At 5 weeks pregnant, the levels of HCG in your body should be high enough to be detectable by most pregnancy tests. However, it's essential to note that the sensitivity of different pregnancy tests may vary. Some tests are designed to detect lower levels of HCG earlier in pregnancy, while others may require higher levels to provide a positive result.
Reasons for a negative pregnancy test.
If you're 5 weeks pregnant and receive a negative pregnancy test result, there could be a few reasons for this. 3.1 Testing too early in pregnancy can result in a false negative. If implantation of the fertilized egg occurred later than expected, it might take a few more days for the HCG levels to rise enough to be detected by the test. In such cases, waiting a few days and retesting can often yield a positive result. 3.2 Faulty test or user error. Sometimes, the issue may lie with the pregnancy test itself. A faulty test or user error, such as not following the instructions correctly, can lead to inaccurate results. It's essential to carefully read and follow the instructions provided with the test kit to ensure accurate testing. 3.3 Ectopic pregnancy or miscarriage. In rare cases, a negative pregnancy test at 5 weeks pregnant could indicate an ectopic pregnancy or a very early miscarriage. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, typically in the fallopian tubes. This can result in lower HCG levels and a negative test. Similarly, a very early miscarriage, sometimes called a chemical pregnancy, can occur before a pregnancy test can detect HCG.
When to seek medical advice.
If you continue to experience pregnancy symptoms and suspect you might be pregnant despite a negative test at 5 weeks, it's best to consult with your healthcare provider. They can perform a blood test to measure your HCG levels, which is more sensitive and can provide a more accurate result than a urine test. In conclusion, while it's generally expected to have a positive pregnancy test at 5 weeks pregnant, there are various factors that can contribute to a negative result. Timing, test sensitivity, user error, or underlying pregnancy complications like an ectopic pregnancy or early miscarriage can all influence the test outcome. If you're unsure or concerned, it's always wise to reach out to your healthcare provider for guidance and support. Remember, they're there to assist you throughout your pregnancy journey. Stay positive, and I wish you the very best on your path to motherhood.